Hello everyone, today I'm going to present upon the status of PT and its working rights in the Australia. All the overseas physios who are looking to practice in Australia are required to go through with this assessment. So please try to be here from start till end. So let's talk about the healthcare system. So working as a PT in Australia. So basically we have to make sure that for the complete course, at the end of this course we will be able to describe the structure and funding of the models of the Australian healthcare system. We will be able to identify the roles and the key regulation organizations. We will be able to explain the different settings in which the physiotherapists work in Australia. We will be able to explain about the scope of practice of physiotherapy in Australian healthcare system. We can compare and contrast the role of physiotherapy in Australia to practice PT in your country of training, identify the key professional services that physiotherapists can collaborate with and make referral to, recognize the professional and ethical issues in the physiotherapy practice. Number 8, apply ethical and professional principles of physiotherapy to clinical and non-clinical scenarios. All these are basically the key outcomes once you will be able to complete this course. Let's talk about the structure of the healthcare system in Australia, how the Australian healthcare system work. So basically two main systems are there. Number one is the public and number two is the private healthcare system. It is important to have broad understanding of these structures that will impact the treatment with the patients. For example, knowing the structures you are working in allow you to understand how you could coordinate care with the other healthcare system. Let's see about the healthcare systems which are public healthcare systems. These are basically government funded systems. These are known as the Medicare. It offers universal access, free or low-cost healthcare services for the Australian citizens and the permanent residents. These included the general practitioner services, medical specialists, and services provided by the public hospitals and the clinics basically. And the private practices include the private practices, clinics and hospitals, and the medical practitioners and the allied health professionals. Private health care is available to those who choose to purchase private health insurance, as like with students and all the overseas practitioners who move there to work, who can afford to pay for the services out of the pocket using their own money. Private health care provides additional services that are not covered by the public system. And who is basically responsible for all these services also in the healthcare system? The non-governmental organizations, NGOs, for example, Aboriginal Community Control, Royal Flying Doctor Services, Heart Foundation, Diabetes Australia, Cancer Council Australia. All these are the NGOs which are working there in the healthcare sectors. And basically, health system. We are not going to explain all about the health system. So we will just have an overview of how the healthcare system in Australia work. It basically, we will check about the healthcare system review, Australian Institute of Health and Welfare, the Australian Health System, and Government Department of Health and Aged Care. This is basically all these systems which are working together to make a compact, and how people get the services from all these NGOs and all. So how people access the ways only the inpatient and the outpatient services, and basically public hospitals and all the government hospitals are actively indulge in providing the healthcare system. This is basically the overview. aisw.gov.au. You can check out about what are the services, Medicare, the private health insurance, hospitals, healthcare system challenges, where do I go for more. So this is basically the responsibility of the healthcare system and all. We're not going through in depth with these processes. Which of the following options? So this is the questions and the queries funding of the healthcare systems. So we have to complete the assessment first. Let's go for the assessment. So let's check out that how much we know about the healthcare system and assessment. With the following are the true about the Medicare. Medicare, as we have already read, it is a public healthcare system funded by the Australian government. It is offer universal access fee, or this is also included. Accessing Medicare does not include membership. Yes, all of the above. This is basically the correct answer. Submit on. We will see that Medicare basically is the private access to the healthcare services. So move on to the next assessment. This is basically a private overview. How is the Australian healthcare system is funded? As we have already seen that the course briefly described the three different funding avenues. Medicare means the government, private healthcare insurances, and additional funding other payment schemes. Medicare, what is Medicare basically? So let's check out that what is the Medicare. Australian public healthcare system is public healthcare system or government healthcare system is supported by the Medicare, universal healthcare insurance scheme for Australian, the New Zealand citizen, and the permanent residents in Australia. Medicare cover all the cost of the public hospital services, also cover some of the cost of the health services and range of the prescription medicine known as pharmaceutical benefit scheme. This is also included in the Medicare. Is funded by the Australian government through taxes, including the Medicare levy and the medical levy surcharges. All these are included in the Medicare. So is physiotherapy covered by the Medicare? Not all the physiotherapy services covered by the medical. For people who are admitted to the public hospitals, Medicare cover all the cost for the physiotherapy treatment, provided an inpatient for some of the cost of as an outpatient. Outside the hospital settings, private practice Medicare benefit physiotherapy are available to the people with the chronic conditions, only available to the chronic conditions that require long-term treatment, like chronic disease management plan. Chronic disease management way individuals to receive affordable and collaborative health care from many different health professions such as physiotherapy. So let's see that covered by the medical, public hospitals, inpatients is covered, public hospitals, outpatient. Medicare covered, private hospitals not covered in Medicare, private practices are not covered. Patient of CDM, chronic disease management is included in all this setting. Chronic disease management, physiotherapy in the private practices can only be covered by the Medicare and the CDM. Chronic disease management, if the patient has chronic and complex musculoskeletal condition requiring specific treatment and has referred by a GP, referred to an issue that has been expected present for at least 6 months. This is the chronicity. Acute, as we know that 1 month, 22 days to 30 or 40 days, acute, subacute 40 to 60 days, and more than 60 days till 6 months, it's being a chronic condition. For most of the individuals who don't have a CDM plan, they would have to pay for the physiotherapy out of their pocket. Work in the beneficial for you to know more about the scheme. There are basically, this is a scheme in which you have to, we have look over about the Medicare. Now we are going to check out about what is the private health insurance. Private health insurances offer individuals opportunity to access a range of healthcare services that are beyond the public healthcare system and not covered by the Medicare. Private health insurance offer individuals get control over healthcare choices, reducing waiting times and ability to access private hospitals and choose your own specialties. How does private health insurance apply in the different physiotherapy settings? Basically, this is the totally included the medical billing and all. The information below summarize how private health insurance works in the context. Basically, this is the accessing the individuals can purchase different type of private health insurance, included the getting the private health insurances which covers the different services. Let's say there's public hospitals, private hospitals, and private practices. These are basically three settings in which we get the number three is additional fundings. Aside from the medical and private health, you will likely come across individuals who are covered under other payment schemes. This section briefly introduced the common funding schemes that are likely to come across in practice as a PT in Australia. National Disability Insurance Scheme, Department of Veterans Affairs, Motor Vehicle Accident Insurance, Work Cover Insurance, and Aged Care Funding. Let's check out a little bit of NDIS, National Disability Insurance Scheme, funding for the eligible people with disability and children with developmental delays to gain greater independence, access to the new skills, jobs, and improved quality of life. As a PT, you may work with the patient under NDIS, which pays for the part of the funding. And second is Department of Veterans Affairs. DVA is a government that provides support service to people who currently serve or have served in the Australian Defence Forces. DVA is only for the Australian Defence Forces. And the MVA, motor vehicle accidents, funding for their injuries, only providing insurances for the MVA, motor vehicle accidents. Work cover insurances only cover about the illness because of the work, related to the work. And aged care funding, that include about the Australian government provide aged care funding for the eligible individuals under the My Aged Care schemes. Three types of care provided under the scheme. Aged care funding for the physiotherapy services may be covered by the home care packages, Commonwealth Home Support Program, or Transition Care Program. So these are basically other options. What other state or area specific, depending on where you work, the specific funding scheme that includes physiotherapy services for each state entirety will have their own type of aids and equipments. What's next? The section common type of funding options, accessing healthcare, and continue to the next and understand how the physiotherapy profession is regulated in Australia. This was basically the insurances and all about the insurances. How is the physiotherapy regulated in Australia? Basically, we will check out about how PT works in Australia. Physiotherapy regulated in Australia is physiotherapy is a regulated profession overseen by the AHPRA, Australian Health Practitioner Regulation Agency, together with the Physiotherapy Board of Australia. This section, basically we have two bodies here, AHPRA and ABA. And this section will briefly introduce your AHPRA, main function, and the council role in helping to maintain the integrity and quality of physiotherapy work. Health Practitioner Regulation Agency and the Physiotherapy Board of Australia. Australian Health Practitioner Regulation Agency is a government-appointed body and is responsible for regulating healthcare professions in Australia, including physiotherapy. AHPRA works with the Physiotherapy Board of Australia to ensure the Australian physiotherapists are suitably trained, qualified, and safe to provide effective healthcare services to the public. The main function of AHPRA included managing the registration process for the PT. The registration provide physiotherapists to provide services directly to the community without referral from a medical practitioner. Number 2, publishing a national register of healthcare professionals. The national register contains a list of every healthcare who is registered to practice in Australia. So PT is also registered there. So registration and maintaining the status of registration in Australia is also regulated by the AHPRA. Number 3, handling professional conduct and fitness to practice matter. AHPRA deal with complaints and concerns raised about unsafe practice or unprofessional behaviors of healthcare practitioners. Number 4, develop standards, codes, and guidelines for the physiotherapy profession. By now, you must have read the practice threshold in Australia and Aotearoa, New Zealand, published by the Physiotherapy Board of Australia and the New Zealand Physiotherapy Board. This document outlined the entry-level competencies and checked the requirements for the Australia and New Zealand physiotherapy graduates. To work as a PT in Australia, you need to be registered through AHPRA with the Physiotherapy Board of Australia, meet the registration standard. So we have to complete these two standards. APC. APC, basically the council plays a significant role in physiotherapy profession in Australia. The two core responsibilities include accrediting education programs and assessing overseas trained physiotherapists. Accreditation. What is accreditation? Basically, accreditation councils accreditates entry-level physiotherapy program delivered by the Australian University, and this is done to make sure that the program meet the certain standard by the Physiotherapy Board of Australia as a part of accreditation process. And the second is the assessment. The council oversees the overseas trained PT to allow registration to practice, and all these overseas trained PTs are regulated and assessed by the APC on the behalf of the assessment process, which include the standard assessment pathway or flyer or express flyer pathway for overseas PTs. So this will be discussed in another session. So what are the pathways to move to the Australia?